Happy to have with us here at ASCO 2012 Miss Lori Redmer, and we're going to be talking about a different form of cancer that seems to be destiny. Lori, you have a very interesting story, and it's very personal, and it seems like some of the most powerful stories that we can tell always have a personal aspect to it. So while you're the new executive director of the Triple Negative Breast Cancer Foundation, before we get into that, let's talk about how you got there.
Sure. Thanks, Tom.
So you were a mom of three, corporate woman, successful career, and then you had your third child, and take it from there.
Sure. Well, one morning I woke up with pain in a breast. Really brushed it off. This went on for about 2 weeks. I was extremely busy, so I put it, mom's needs come last sometimes. Ended up going in for some diagnostic imaging after I spoke to my gynecologist, and I was still lying on the table when a radiologist came into the room. He was hovering over me, looked like he was about 12 years old, and he pronounced my name wrong and said, "You have a large cancer in your left breast." Am I saying that right? And I was so stunned and so surprised that I really thought, look, the guy can't even get my name right. Could he have possibly read this test right? But indeed he had, and it was all confirmed with a biopsy just 6 days later. And then went on to axillary node dissection with cancer in a number of nodes. But then I really got what was a blow, which was the pathology came back, and the cancer type was triple negative. And triple negative breast cancer is a very virulent, aggressive type of breast cancer. It tends to strike younger women. It often cuts women down in the prime of their life. Robs children of their mothers. It can be a very bad player, as my oncologist told me. So I had worked in breast care advocacy for a brief period before, and when that news was handed to me, I really knew what it meant, and I really knew I had the fight of my life in front of me, and I knew how to do that. I knew how to buckle down and to really be at war with this bad player. What I really had no idea how to do was, after treatment was done, because there is no targeted therapy for triple negative, I didn't know really how to deal with the uncertainty. And I wanted, once the course of treatment was completed, that for me personally, and I think for many survivors of triple negative, it is really the hardest time, because here you are, discharged back into your regular life, no further targeted therapies available to you like most of your friends who have other kinds of breast cancers. And you really become concerned then with things like diet, with exercise, with alcohol consumption, with environmental factors, anything that might give your body the best chance to ward off any sort of recurrence. And that was very true for my case.
So rather than just saying, I'm someone who's undergone a series of life-changing moments, you decided to change your life, change your lifestyle, and actually accomplish something and checked off something on your bucket list, running a marathon.
I sure did. So I had planned to run a marathon in 2010. I was diagnosed on January 12th. So, I really thought on the day I was diagnosed that plan might go out the window. Right. It just didn't seem like, it didn't really even seem important anymore. I sort of had a different marathon that my path was taking me toward. But through treatment, I really found exercise to be extremely cathartic. And even I was also on a clinical trial, so I was on an Avastin trial. I was completely knocked out about the third, fourth, fifth day after chemotherapy, but I did find solace and healing in walking and running, even on those very difficult days. So I began my training while I was in the middle of ACT.
More power to you.
Yep, I ran through radiation. I was like Forrest Gump. I just kept running.
Wow.
And December of the same year I was diagnosed, I ran my first marathon. And I wasn't the fastest, but I did finish. And yes, it was on my bucket list, and I did cross it off.
Well, you are a finisher, so you get past the stage 3 breast cancer.
Yes.
and now you're disease-free.
Yes.
And now, even more so, it seems like cancer was destiny for you, because now you're working to help other women just like you, and you found partnership with the women who helped you.
Sure. Well, I like to say I was a reluctant traveler on this path. I, of course, did not choose cancer. No one would. It was a journey I didn't want to go on. But another part of my healing was really to accept that it happened, and what can I do with this, sort of lot that's been cast. And I really felt that the best thing I could do to use my experience productively was to take care of myself. That was the whole exercise and running piece. But then really to pay it forward. People were so incredibly kind to me. Someone said to me right after I was diagnosed, "You're about to find out how much you're loved." And, I'll never forget that as long as I live. And really, I had every advantage. I had wonderful insurance. I had a supportive family. I had resources. I had childcare. And it really haunted me. The women who would go through the same shock, the same being on a journey they didn't want to take, that didn't have the same resources I had. So I first started out with my community hospital doing quite a bit of volunteer work for them around some survivorship programs, some technology programs. And then I thought about the fact that I had really used the Triple Negative Breast Cancer Foundation's website and what a great organization it was and how helpful it was to me. Things like 100 questions to ask your oncologist and a variety of things like that I had found so useful. And I thought, I'm going to check out that organization, see if they need anything in the coming year in 2012. And I did that in about September 2011. And a couple days before, they had posted the job for the executive director. And having worked in the not-for-profit world for almost a decade with Save the Children, it was experience that then I could leverage both professionally and personally.
Talk about meant to be.
Yes, exactly.
All right, so now you're in this meant to be position.
Sure.
What are you hoping to accomplish with it? What things are you going to keep going and try and build, and what new wrinkles do you want to bring to it?
Yep, absolutely. Well, there's a few things. First of all, we're really focusing for the next, I'd say, near to medium term on the issue of racial disparity in triple negative. So there's some very interesting things about triple negative breast cancer. We really know more about what it isn't than what it is. And it's a puzzle. It's very complicated. So one thing that we do know is that if you're an African American, you're much less likely to get breast cancer. But if you get breast cancer, it's 2.5 times more likely to be triple negative than if you're Caucasian. Well, that would seem to suggest a lot of things, possibly a genetic link, possibly access to care issues and things like that. And, prognosis is often worse for African American women as well. We're committed to looking into this mystery and unlocking it, and we're working with others to help us with this puzzle. We just had our biggest fundraiser of the year, Peace, Love, and a Cure. It was a couple days ago. We had wonderful support from Robin Roberts, who's a triple negative breast cancer survivor herself. And, she's been wonderful about this issue and certainly will be an ally. We also honor General Electric. They're committed to healthcare disparity issues and also to triple negative, and in fact they just recently launched an Open Innovation Cancer Challenge where they awarded a significant amount of funding to triple negative researchers. So they're definitely someone we're proud to have in our corner.
Okay, so if this organization was helpful to you, it can be helpful to others. How can they find you, and what could you offer them?
Sure. Our website is tnbcfoundation.org. So we have many tools there. A couple other things that we really hope to accomplish in the near term is we want a newly diagnosed patient who's finding us right when they're in crisis mode to know that the odds are still in their favor. And I don't think people always hear that from their oncologists. The oncologists are pretty conditioned to say it's a bad breast cancer, it's the worst breast cancer, but the odds are still in your favor for disease-free survival. We think it's really, really important the newly diagnosed patient knows that, so that's really crucial. So those are some of the things that we're hoping to, bring to about 20,000 women this year who will be diagnosed with this disease. Yes, it's rare relatively, but there's a large group of women who are afflicted with this, and we're there to give them hope, support. We're a caring community. We have forums. We're a credible source of information with a fantastic scientific advisory board. Eric Weiner, George Sledge, Lisa Carey, Dr. Lisa Newman, and Susan Domchek. So all people who can help these patients really have confidence in what we say, that it's credible. And then probably most importantly, we're a catalyst for the cure. We're investing in research, targeted therapy. It's around the corner. We really believe that. So we're very committed to making sure that we're doing our part to push and nudge the scientific community in that direction.
Lori Redmer, you bang the drum. You're a voice that needs to be heard.
Thank
and an
you.
Inspiration to many, many people, women and men. Best
Thank
of luck
you.
to you.
Thank you.